Welcome to the Vitos Orthopaedic Clinic in Kassel. When it gets better, then try another step forwards. We are one of the largest orthopedic hospitals in Germany. Our motto is competence achieved by specialization. We are able to offer you the entire range of methods for postural and movement treatment. We only have one aim. You, the patient, should get back on your feet again as soon as possible. More than 270 staff are on hand to look after your well-being. Our clinic has the status of an academic teaching hospital with 180 beds. All of our operating theatres are equipped with state-of-the-art medical equipment. The clinic is situated on the fringes of a recreational area known as the Bergpark in Kassel, and is close to 2 tramcar stops and the ICE Kassel-Wilhelmshöhe railway station. We're easy to reach for patients from all parts of Germany or abroad. From a simple massage right up to a spinal operation, our range of services cover all areas of orthopedic medicine. I've got a stationary appointment. On admittance to our clinic, you enter a friendly reception area where you're given a form to fill in, and we are there to help you. Please remember to bring your doctor's findings, any X-ray photos that may be available, patient referral, and your health insurance documents. Your health insurance card and the referral. If you would like a TV or telephone in your room, the staff in the reception area will only be too glad to help. We treat more than 5,000 stationary patients on an annual basis and more than twice this number of outpatients. An exact diagnosis is imperative. Apart from standard examinations, the Vitos Orthopaedic Clinic in Kassel offers special examinations with the highest technical standards in the fields of postural and movement medicine. Here we have every possibility for orthopedic imagery, such as computerized tomography, MRT, X-raying, and bone density measurement. A special feature that we also provide is open nuclear spin tomography, which helps us to examine very heavy patients and patients suffering from agoraphobia. In the forefront, we're also interested in that patients are well informed and know what will be happening to them. This is why we invite people on a regular basis to take part in a preparatory course. We also stage lectures given to patients on a regular basis featuring various topics. This is not being done to find out more details. We want to take a little look inside the knee joint. Then again, we also have various brochures for our patients about arthrosis, spinal, hand and foot complaints. They're to be found in the reception area of the clinic, the various wards, and also in internet on www.vitos-okk.de. What is on offer on the web includes more information about what the clinic has to offer, the special appointments, and special information about a forthcoming stay as a stationary patient in our clinic. This clinic has 3-bed, 2-bed and single rooms. They all have a shower and toilet. If requested, a special multimedia system can be provided with 20 television channels. The remote control unit can also be used as a telephone. All rooms are covered by a wireless LAN system which allows patients to surf the World Wide Web free of charge or even send an email. And everything can be done in comfort from the patient's bed. As a special service, we also provide roomy apartments so that patients can be continually close to their relatives. Good morning. How are you? The rounds carried out by the ward physician on a daily basis are a matter of course. The clinic superintendent or one of the senior physicians can also pop in on a regular basis to ask patients how they're getting on. In spite of the high standard of specialization, our clinic is still generally open and things are transparent. The doctors know the nursing staff and they know the physiotherapists. It's something that a patient can feel. The clinic has an extremely personal atmosphere, which is certainly more pleasant than larger clinics. Our doctors are specialists and offer regular outpatient consultations. The separation between the various specialist fields guarantee the highest possible knowledge and performance. This is why the Vitos Orthopaedic Clinic in Kassel is one of the largest centers for the implantation of hip and knee joints in the whole of Germany. Medical Superintendent Professor Dr. Werner Siebert was directly involved in the development. Thank goodness that we're already extremely close to nature. Artificial hip joints are the most widely known possibilities, but we also have artificial knee, shoulder, bone, as well as finger joints, which can also be set in place in a minimally invasive manner. A prosthetic device is only used when other methods appear to offer little success. Put your trust in our experience. The artificial joint is a success story. Beginning in the 1950s, 1960s and 70s, we've managed to collect so much experience that the large numbers of cases carried out in specialist clinics these days have now become routine work. The quality of life has been completely restored. Patient can go hiking. Other hobbies and sports, even high-performance sport, can be taken up again with certain limitations. Generally speaking, a patient can put weight on the joint from the first day onwards. We try it out with standing up. You've practiced a little. Hold on here. An 80-year-old sportsman can do it, or not? Great. Be careful putting on your shoes. Let me support you a bit. Now stand up and impose your weight. Only a couple of days after the operation, he can now stand up. Our hospital is a recognized and certified pain clinic. Chronic pain, as an independent clinical picture, can be brought about by any number of causes and have any number of symptoms. This is why experts from various fields of medicine work together in our pain conference working group. So-called problem patients are examined in detail, and a joint diagnosis and therapy is put together. What can we do with drugs and medicaments? Sensible treatment can only achieve success when all the factors have been looked at. 80% of pain patients stem from the orthopedic sector, meaning that the problems come from the postural and movement areas. This is why an orthopedic clinic and an orthopedic specialist are predestined for a primary pain therapy. But it's also necessary not only to examine the orthopedic side of things, but the soul and mind of the patient and social problems as well. And this is what we can do in our team. The whole spectrum of treatment available to us ranges from electroshock therapy to acupuncture and to relaxation exercises. These can be sensibly combined with each other. Please tell me when you get a tingling sensation like ants on your skin. The treatment of spinal complaints is another central aspect of our specialized clinic. We use the most modern operation methods, such as microsurgery. The aim is to achieve the maximum safety level during the operation. The methods range from minimum invasional techniques to large-scale stiffening surgery. Can you stand on your toes? This man underwent an operation on his intervertebral discs a few days ago. Today, he's almost free from pain. The next patient has had serious back problems for years. Stiffening of the lumbar vertebral column is expected to bring improvement. In a normal way, we usually carry out 200 to 300 operations of this type on an annual basis. Added to this, we have prosthetic and scoliosis surgery, as well as many other facets of spinal column surgery. For those patients who cannot be taken directly back to normal wards after an operation, we have an intensive observation unit consisting of 8 beds and the most modern observation equipment. Here we have specialists for anesthetic, orthopedic and internal medicine. High-tech observation equipment and personal care are in no way contradictory. Then there's the observation center, where nursing staff keep a keen eye on important data such as heart frequencies and blood pressure values. All this guarantees optimal care 24 hours a day. Treatment for infants, children and teenagers demands special orthopedic knowledge, where early recognition of problems are involved. This is a special field in the case of these small patients. A double-sided club foot sees a conservative splint utilized, and it's successful. As a clinic, we are specialized in the treatment of congenital and acquired health problems affecting children and young people. These include the congenital club foot, the typical hip joint problems in children, as well as shoulder disabilities of the upper and lower extremities. Come over to me. Our mother and child units mean that patients can visit their young offspring 24 hours a day. Visiting can take place at any time of day or night. The human hand consists of 27 individual bones, 33 muscles and 22 joints. All this situated in a very small space. Hand surgery represents an extremely complex field. In the Vitos Orthopaedic Clinic in Kassel, we have special doctor-patient appointments. Treatment of the so-called carpal tunnel syndrome, which this patient suffers from, has become a standard operation for our experts. In this clinic, we offer the complete spectrum of the hand surgery field. This includes the congenital abnormalities or the acquired problems such as the du patron contracture, which is widely known because the fingers become bent. We also have the nerve pressure syndrome in our program. There are a lot on the upper and lower extremities. We shouldn't forget the hand injuries which have failed to heal properly and may require extremely complicated corrective surgery. Rheumatism is a medical expression for pain in the movement system, which is based on the Greek word for flow. The pain doesn't remain stationary in one place, but flows through the entire body. The intensity varies as well as localization and timing. The shaft is set in the head of the humerus. The term rheumatism can also be caused by various medical problems where only a specialist can gain an overview and make an analysis. Artificial joints can often reduce the pain suffered by many chronic cases. In our clinic, rheumatism patients are also treated by internal medicine specialists. Our treatment spectrum is rounded off with our large physiotherapy department. Everything is coordinated in an optimal way. One has to follow an overall therapy concept when treating rheumatism sufferers. Apart from orthopedic surgery measures, the patient must also get treatment in the internal medicine sector. We've had experts in both these fields in our clinic for years, meaning that patients can be treated accordingly. The numbers of patients with acute injuries and illnesses have been steadily rising in the past. We have a large emergency department in our clinic where doctors and nursing staff work in 3 large rooms directly connected to the stretcher entrance so that they can help a number of patients at once. Modern equipment is on hand to assess the state of the injuries as quickly as possible. It's all arranged so that all therapeutic treatment can be started at once in a coordinated way. The emergency department is so laid out that we can help the aged and very small patients suffering from injury. Here we have a competent team of doctors and nursing sisters because we know injured people need help and soothing words. We specialize in the care of older patients with perhaps a fracture of the neck of the femur. The treatment of sporting injuries is also a further aspect of our specialized clinic. In special sport consultations, we deal with the specialized needs of top-line sport and other broad-ranging sporting activities. Modern equipment is on hand for the treatment of chronic sporting injuries. This training therapy is augmented by massage, medical baths and physiotherapy. Should an operation be required, then we do our best to use minimal invasive methods. We know that you, the patient, wants to get back on your feet again as quickly as possible. In our clinic, we deal with large numbers of sporting injuries. In this case, the injury occurred in a basketball game. The patient suffered injury to the cruciate ligament. We used a minimal invasion operation using arthroscopic techniques to replace the cruciate. This means that the joint capsule, which is the controlling structure, remained intact. Rehabilitation was naturally much shorter. What we're now doing is simply doing a strain test on a bicycle ergometer. In our clinic, we not only deal with injured sportsmen and women, we also work with active sporting individuals. The State Sports Association in Hesse has recognized the Vitos Orthopaedic Clinic in Kassel as a recognized sport medical examination body. Our medical gymnastic treatment doesn't only improve mobility, but supports the blood circulation system and the healing system in full. You're in the right hands here. Get a breath of fresh air. Our little clinic park provides greenery where you can relax. It doesn't matter whether you can walk again or are dependent on crutches or a wheelchair. Enjoy the pleasant, relaxing atmosphere and concentrate on the most important thing, getting well again. sunlit cafeteria with 45 seats can provide a large selection of cold and warm meals and drinks together with magazines and newspapers. When the weather is fine, you can enjoy your cup of coffee and a piece of cake in the park or in the courtyard. Something sweet or refreshing can also be got from the vending machines outside of opening hours. Once treatment has been completed, we don't leave you in the lurch. We gladly organize your final rehabilitation. You don't have to worry about a thing. Here, the person concerned is the central point. This is why our main aim is to allow patients to leave the clinic as quickly as possible. The finest clinic in the world can never replace someone's home. And this is why we try to make your stay as pleasant as possible.